Am I audible to everyone?
Yes, sir.
Good afternoon, everyone. Please tell your remaining batchmates to join as soon as possible. We are already 1 hour late, but although you please convey the message. I'll wait for another 2 to 3 minutes. At least 100 students should be there. What happened to rest? Here the attendance is 83 students only. Roll number 82. Arihan. Join by 4.
Sorry, sir.
You told everyone to join by 4.
80. अरे काय बोलले? अरे
Am
बंद कर ना.
I audible? Am I audible?
Yes, sir.
Aryan, did you told everyone to join by 4?
Yes, sir. I told everyone to join by 4. बताया था सबको.
Who is the girls here?
Sorry, sir.
Girls here?
Girls here. Roll number 108.
108, please respond. One zero eight. Okay, absent. Am I audible to everyone?
Yes, sir.
Okay. And the slides are visible?
Yes, sir.
So today's topic we will discuss osmotic fragility and specific gravity. How to perform the procedure I cannot perform in front of you now because practical classes cannot be taken online. So I will be discussing you the procedures like a theory part only. So basically starting what is specific gravity? It is defined as the mass of any volume of substance by mass of an equal volume of water at 4 degree temperature. Now the question is why you have taken this comparison in 4 degree temperature, 4 degree Celsius temperature. It is because the density of water is maximum and thus it is ideal for recording the specific gravity. At 4 degree temperature, the density of water is maximum. So that's why we are recording the specific gravity at 4 degree temperature. So what are the methods, different methods to determine the specific gravity? There are two methods. One is direct, another is indirect. I want to tell you that these two practical topics are like specific gravity and osmotic fragility are important only for theory purpose. Sometimes examiners ask you this in like practical viva. It is very rare, rarest of the rare case you will be given these practicals to perform. So I think like specific gravity and osmotic fragility, I think you should know the theory parts only. So two methods, direct method, an equal volume of blood and water is taken in capillary tubes called pyonometers and weight has been taken. The ratio of their weight gives the specific gravity of blood. This is the direct method. And there are two indirect methods. First one is Hammersling method and second is Phillips and that's clay copper sulfate method. So the normal values in case of blood, the specific gravity is 1.048 to 1.066. In case of RBCs, it is 1.092 to 1.095, and in case of plasma, it is 1.026 to 1.035. So, what are the things that can affect or that can manipulate the specific gravity? First is RBC count, second is hemoglobin concentration, third is plasma protein, and fourth is water content. So the conditions, the physiological conditions where we can see an altered specific gravity, you can see the specific gravity of blood is low in case of females, and in male it is higher. And in the afternoon it is lowest, while during night the specific gravity is the highest. So during pregnancy it is low, and after high water intake it is low. So these are the physiological conditions that where we can see an altered specific gravity. Now the pathological conditions, coming to the pathological conditions which altered specific gravity, we can see like it will be high in vomiting or in diarrhea, or any condition where vomiting and diarrhea occurs, like in any condition where loss of body water actually occurs. Suppose a person is suffering from acute gastroenteritis or a person of severe hemorrhage. So wherever the loss of body water will be there, it will be high. So what is the significance of determining the specific gravity of blood? Why should we determine the specific gravity of blood? What is the use? If we know the specific gravity of the blood, so we can measure by using the values of specific gravity, we can measure indirectly the hemoglobin content of blood, the PCV, the blood protein, and we can also diagnose the degree of dehydration. So these are the different formulas and relations. Hemoglobin content for 100 ml of blood equal to 33.9. Within brackets, specific gravity of blood minus specific gravity of plasma divided by 1.097 minus specific gravity of plasma multiplied by 10. But the packed cell volume will be for 100 ml of blood will be 100 within brackets specific gravity of blood minus specific gravity of plasma divided by 1.097 minus specific gravity of plasma multiplied by 10. And how we diagnose the degree of dehydration is like if the specific gravity of blood is more than the specific range, then the specified range, which is the normal range, the degree of dehydration is high. And on the opposite side, if it is low, then it will be low. So specific gravity, this much theory is enough. It is like you just read it once. So if like sometimes some examiner want to ask, you can you can answer in the practical viva. Your senior batch, I have not seen any of them has been asked any question on specific gravity or osmotic fragility. But I want to say that you might get one MCQ either in your IA or in your prelims from this specific gravity. Osmotic fragility, it is ease with which the RBCs are broken down, that is hemolyzed in hypotonic solution, is called as osmotic fragility of RBCs. It is expressed in terms of concentration of hypotonic solution in which the cells are hemolyzed. Till there any confusion? You want to ask me something?
No, sir.
Okay. So this topic is not that much important if we take in exam point of view. So nothing to be hide and nothing to be hidden from you. So coming to ESR. Now this is very important. Both in your clinical practice you will be requiring a good knowledge of ESR, and so many questions will be asked from ESR in your exam, in practical exam also. And we might ask 1 to 2 students to determine the ESR. So what is ESR? The full form, I think all of you know, it is erythrocyte sedimentation rate. So what is the definition? It is the rate at which RBCs settle down when blood to which anticoagulant is added is allowed to stand in a narrow tube for 1 hour. So basically the ESR is expressed in millimeter of clear plasma at the end of first hour. So what are the different stages in this 1 hour? Actually there are 3 stages. First stage is of 10 minutes, second stage occurs in next 40 minutes, and the third stage occurs in next 10 minutes. In these 3 stages, step by step what happens in first stage of first 10 minutes, the Rolex formation and aggregation occurs. In the second 40 minutes in the second stage, sinking of aggregates takes place at a constant speed. The last 10-minute stage, the third stage, the aggregated cells pack at the bottom of the tube. So the determination of ESR and PCV, the apparatus we need, all the apparatus we need are, one is pricking apparatus, that is needle, Wintrop's hematocrit tube with rack, penicillin bottles, Westergen pipette with rack, long nozzle capillary pipette, which is also called a Pasteur's pipette, centrifuge machine, powdered mixture of ammonium and potassium oxalate, which we can call a double oxalate together, 3% of solution of sodium citrate. So there are basically 2 procedures to determine ESR. 2 methods. One is Wintrop's method, another is Westergen method. But when we want to record the PCV, which one is peak cell volume, there is only one method, that is Wintrop's method. Any confusion? Any confusion? These are the apparatus which is which are required to determine the ESR and PCV. By Wintrop's method, we can determine the ESR and PCV both. Whether the Westergen methods give the result of ESR only. So coming to the Wintrop's method of determining the ESR value, the procedure, you can see that you have to draw 5 ml of venous blood. See, till now whatever practical you did, you drawn only your capillary blood. So by capillary blood, it is very difficult that you draw 5 ml. Okay, so I have seen some of you, like not some, most of you are unable to draw like blood, even like 2 to 3 ml capillary blood for your RBC or your this hemoglobin or WBC practical. But so 5 ml is unexpected, you cannot do. So no one can do. So here we need venous blood. You have to draw 5 ml of venous blood from any convenient vein. Preferably we use antecubital vein. So any convenient vein is like you can take, wherever blood should come 5 ml. And you should gently mix it with powdered mixture of double oxalate. What is double oxalate? Double oxalate means 6 milligram of ammonium oxalate and 4 milligram of potassium oxalate. You should take it in a penicillin bottle. Now, you have to draw this anticoagulant mixed blood into the long nozzle capillary pipette and pass the tip of the pipette right down the bottom of the Wintrop's tube. So, how does the Wintrop's tube and Westergen pipette look like? I cannot show you here. I think once you come back to the offline classes, we will do this practical, and that time it will be a revision class for this practical theory, and we will perform the demonstration as well as the student work. But for now, if you want to know how the Wintrop's tube looks like or Westergen pipette looks like, you can just open a practical book, or you can just search in Google the images of Wintrop's tube and Westergen pipette. So coming back to the topic proper, so you have to draw this anticoagulant mixed blood into the long nozzle capillary pipette and pass the tip of the pipette right down the bottom of the Wintrop's tube. Now you have to apply pressure to the teat of the pipette so as to force the blood slowly out of the pipette into the hematocrit tube. At the same time, the pipette is gradually withdrawn out of the tube. This should be done at such a rate that air bubbles should not form in the tube. This should be done at such a rate that air bubbles should not form in the tube. Fill the tube up to 0 mark and keep it vertically in its rack. Note the time. Take the reading of the upper layer of RBCs at the end of 1 hour. Any confusion till now? This is the procedure as per Wintrop's tube method of determining the ESR values. So you can see by this procedure, ESR in case of male it is 0 to 9 mm at the end of 1 hour. This is the unit. The unit of ESR if it is asked, it is millimeter at the end of 1 hour. Millimeter at the end of 1 hour is the unit of erythrocyte sedimentation rate. In case of males, it is 0 to 9 millimeter. In case of females, it is 0 to 20 millimeter. It is the normal values. By Wintrop's method, by Westergaard method, it is different normal value. The value, normal value is varies which procedure you are doing. In exam, it is very frequently that if the examiner want to give you a good mark, like 80 to 85% mark in practical, the examiner want to give you. Then in Viva, practical Viva, the examiner might ask you to tell the normal values of erythrocyte sedimentation rate. If you tell 0 to 9 mm at the end of 1 hour in case of males, or 0 to 20 mm at the end of 1 hour in case of females, you will not get that grace, that extra marks which examiner was supposed to give you. You have to say that 0 to 9 mm at the end of 1 hour in case of males and 0 to 20 mm at the end of 1 hour in case of females by Wintrop's method. Method name also you have to tell. Any confusion? Any confusion? And please keep in mind these values till you are practicing medicine. After becoming doctor also you will be in need of these values. It has very significant clinical importance. Coming to the Westergaard method of ESR. In a penicillin bottle, take 1 ml of 3.8% sodium citrate solution, which is an anticoagulant, and mix it gently with 4 ml of blood taken after a vein puncture. Suck the citrated blood in the Westergaard pipette up to 0 mark and immediately close its upper opening with the thumb to prevent blood from running down. Then press the lower end tightly on a rubber pad and fix it in an exact vertical position with leveling screws in the Westergaard stand. You should note that the time. And take the reading of ESR at the end of 1 hour. This is the procedure by which you can do ESR by Westergaard's method. See the value difference over here. In Westergaard, the normal values are 3 to 5. In case of male, and in case of female, it is 4 to 7. I want to show you the normal values. It is 0 to 9. It was in Wintrop's male 0 to 9, and here it is 3 to 5. See, female 0 to 20, and here it is 4 to 7. Now you understood the difference. Why you should tell the method name when you are telling the normal values. Understood or not? Please reply. Or everyone just logged in and seeing Netflix.
Yes, sir, we understood.
So what are the factors that affect sedimentation process? 4 factors can affect. One is Rolex formation, another is viscosity of plasma, the ratio of cells to plasma, and the nature of anticoagulant used. The physiological altered ESR values. What are the conditions physiologically where you can see an altered ESR? This question is frequently asked in university exam by the external examiner. Last time also like almost 80% student was asked this question. Tell me physiological reasons of altered ESR values. Please keep in mind, age lowest in the newborn, it is 0.5 mm at the end of first hour by Western Green method. Why it is so? Due to the more RBC count. Gender is another thing. Females value will be more than males because females are having low RBC count. Pregnancy, in pregnancy the ESR will be increased because the increased fibrinogen levels will be there, which will lead to increased Rolex formation. Temperature, it is directly proportional. That means if the temperature increases, ESR value will be increased. If the temperature decreases, the ESR value will be decreased. So don't tell if by the ESR value is normal or not. If you are checking online a patient by any e-patient app, like a patient is from Shimla and you are checking from like Tamil Nadu, so don't tell the values like this ESR value variation because it will vary due to temperature. You have to consider it. So what are the pathological reasons of altered ESR values? Increased in case of anemia, infection, malignancy, nephrosis, severe trauma. When I am saying anemia, please keep in mind this question has been asked thrice in the NEET exam. Which anemia doesn't cause increased ESR values? It is the pernicious anemia. Due to the lack of intrinsic factors, it cannot cause increased ESR values. The decreased ESR values, again, see, if this side was anemia, so here it is polycythemia. This side was infection, so decreased will be leukemia. Here, pernicious anemia, it will be decreased. The heart failure, congestive heart failure will be there. It will be decreased ESR values. Protein shock. What is protein shock? Like the cases of burn or dehydration. These are the cases of protein shock. There it will be decreased ESR values. And severe allergic reactions. There it will be decreased ESR values. Coming to the packed cell volume or hematocrit. I think the significance of packed cell volume I already told yesterday why it is required. Like without knowing the packed cell volume report, you cannot determine MCH, MCV, MCHC, which are the blood indices. So today I will tell you how to determine the packed cell volume value. So what is packed cell volume? It is the volume of cellular elements per unit volume of whole blood. It is expressed as percentage or as number of ml per 100 ml of blood. It is determined by centrifuging oxalated blood in a graduated tube until no further reduction in the volume of cell is noted. So here comes the Windrow's method of packed cell volume determination. There is no Western Green method. Western Green method is in ESR. Windrow's method is in both, but the procedure is different. So this is the procedure of how to determine the packed cell volume by Windrow's method. Take double oxalate mixture powder. Double oxalate means ammonium oxalate and potassium oxalate. Ammonium oxalate 6 mg and potassium oxalate 4 mg. Take double oxalate mixture powder in a penicillin bottle and add the blood obtained from vein. Fill the Windrow's tube with this anticoagulated blood up to 10 mark of the hematocrit readings. The second step, after closing the mouth of the tube with a cord, transfer it to the centrifuge machine to centrifuge it at the rate of 3000 rpm for 30 minutes or more till the cells have settled down due to the centrifugal force. After this 30 minutes or after this settling down of the cells in the centrifuge machine, there will be three layers will be formed. The first layer will be clear plasma layer, which will be the uppermost layer. The lowermost layer will be red layer, which will be due to the RBCs settling down. And in between the first, the upper layer and the below layer, the lower layer, a buffy coat layer will be there, which will be due to the WBCs and platelets. See, the color will be the grayish red color. its normal thickness is about 1 millimeter. So after the 3 layers are formed, you have to take out the tube and read the taxol volume value in the tube. The height of the, how will you read the height of the column of the cellular component, like the below layer, no? The where the cell RBCs has been settled down. The height of the column of the cellular component is taken as packed cell volume. Actually, you the second point you see in the slide, the red layer below, which is formed of RBC. You have to see just that only to determine the taxol volume. Till what level it is there. That is the taxol volume value. Express the value as the percentage of blood. What are the normal values here? Taxol volume, the normal values, average is 45%. The range, it is 40 to 50. In case of females, it is average 42%. The range is 37 to 47%. What is the significance? By knowing the taxol volume and by knowing this RBC count and hemoglobin concentration, we can know the blood indices and we can determine what type of anemia a person is suffering. Is there any confusion till now? Is there any confusion till now?
No, sir.
No.
Abhay, Suresh, logged in and went out. Aditi, Alankrita, Arihant, am I audible?
Yes, sir.
Alankrita,
Yes, sir.
any confusion you have?
No, sir.
I have one confusion for you. Please tell me, why it is so that in pregnancy the ESR values are increased? Why it is so that in pregnancy the ESR values increased?
So, during pregnancy, plasma protein.
I'm not hearing. Can you please increase the voice? Be louder, please. Alankrita.
So, during pregnancy, plasma protein increases. Maybe that's why it's increased.
Is it the all plasma protein like albumin has a role here or any other plasma protein? You are partially correct.
The fibrinogen.
Fibrinogen. Okay, very good. Gopika,
Yes, sir.
can you please tell me what is the importance of recording the PCV taxol volume?
Sorry, sir.
What is the importance of recording the taxol volume value? Why should we determine the taxol volume? Don't worry, I have not written this in any of my slides. I just told. You were attentive in the class or just logged in and roaming here and there?
No, sir, I was listening.
So tell me what is the significance of recording axial volume? Okay. Ishika, Ishika,
Sir.
Ishika, can you please tell me what is the significance of recording axial volume value?
Anemia and during dehydration.
No, I am asking about the pixel volume. Why you want to determine the value of pixel volume?
We cannot calculate other blood indices without the help of PCV. That's why it needs to be determined
And
first.
why do you want to determine the blood indices?
Abnormalities,
Abnormalities of
formed elements.
abnormalities of
Formed elements.
formed elements. I think we determine the different morphological types of anemia by the blood indices. Is it so?
Yes, sir.
So, Vishal, Vishal is there? Vishal, Vishal. Okay, logged in and out. Meghna is there? Okay, understood. So no need to discuss. I think all of you, most of you are logged in and out. So those who are still there, you have any confusion?
No, sir.
No, sir.
No, sir.
So these are the factors affecting sedimentation process, uh, like Rolex formation, viscosity of plasma, ratio of cells to plasma, and nature of anticoagulant used. So this was my last slide. Normal values of PCV. Thank you.
Thank you, sir.
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 Thank you, sir. Sir.
Sir.